Hi, my name is Yamilet Maya and I will be performing my skills video on drawing up insulin. I have gathered my supplies here. I have my patient, my two medications, regular insulin and NPH, which is the intermediate insulin. I have my insulin syringe here, 29 gauge with a 0.5 needle. I have my gloves, I have some alcohol pads, I have my gauze, and then I also have a sharps container down on the side. I'm gonna go ahead and get started by verifying the healthcare provider's orders. It looks like the healthcare provider has ordered the patient 4 units of insulin, regular insulin, and 8 units of NPH or intermediate insulin before breakfast. We're going to do the 6 rights of medication administration, which is the right patient, the right drug, the right dose, the right time, the right route, and the right documentation. Once we have done all our checks, we can go ahead and approach the patient. We're going to enter the patient's room and close the door behind us for privacy and introduce ourselves to the patient. Hi, Mr. Smith. My name is Yamilet and I will be your nurse for today. Can I have you verify your full name and your date of birth? Once the patient has stated their name and their birthday, we're going to verify that against their wristband to make sure we have the correct patient. We're going to explain to the patient what is going to be done today, what medications will be administered, common side effects, adverse effects, and also let the patient know what the medication is used for. Okay, Mr. Smith, so your doctor today has ordered you to have insulin before breakfast. He has ordered 4 units of regular insulin and 8 units of NPH or intermediate insulin. This insulin is a diabetic management and helps glucose enter the cells to produce energy. Some common side effects that you could have is sweating, weight gain, or pain at the injection site. Some adverse effects, which is what we don't want to happen, is seizures or hyperglycemia, which is low blood sugar, or hives. You might feel some stinging and burning when I give you this injection, which is normal. It should resolve pretty quickly, but if you do experience any of these adverse effects, please notify me immediately. Do you have any allergies to medications, food, or environmental allergies? No? Great. So then once the patient has stated that they understand everything and they don't have any questions, we're going to have another nurse come in and verify the medication. So once the nurse has got into the room, we're going to make sure our calculations is correct. So we have 4 units of regular insulin that we would be administering and 8 units of NPH or intermediate insulin, which is a total of 12 units in total. Once the nurse has verified those calculations with me, I will thank her. Thank you, nurse, for helping me with that. And then once the nurse exits the room, we can go ahead and continue. I'm going to go ahead and perform hand hygiene, and I'm going to apply my gloves. So the first thing we're going to do is we're going to check the patient's glucose levels. The patient's glucose levels is at 110. The common target blood glucose before meals is 80 to 130, so we are good to administer the medication. I'm going to go ahead and grab both medications and roll them from side to side just to warm them up and make sure everything is mixed appropriately. Okay, I'm gonna set these down. I'm gonna grab an alcohol pad. I'm going to open that. And we're going to clean the top of both vials. Okay. going to just dispose of this in the trash can. While the tops are air drying, we're going to open up our vial, our insulin vial. And without removing the cap, we're going to draw up 8 units of air. Okay, so we have our 8 units of air. We're going to remove the cap. We're going to remove the cap. It is at 8 units. We're going to grab our NPH, or intermediate insulin. We're going to just carefully inject it without touching the solution. We're going to inject the air. We're going to withdraw the needle, and then we're going to draw up 4 units of air. Okay, and then we're going to inject that into the vial of the regular insulin. We're going to inject the air, and now we're going to invert, and we're going to draw up the 4 units of insulin. Okay. Once we have drawn our 4 units of regular insulin, we're just going to flicker off any air bubbles that we see in there, and then we're going to verify the correct units against the EHR on the computer. So we need 4 units of regular insulin. We see it is 4 units on here. Okay, perfect. And now we need 8 units of NPH, or intermediate insulin, which will be the total of 12 units. So once we have confirmed that, we're going to go ahead and inject it into the NPH, or intermediate insulin, and without pushing in any medication, we're going to withdraw up to 12 units now. Perfect. So we have 12 units in total here. Once we have confirmed this with the electronic, with the EHR, that we have 12 units, we can go ahead and cap the needle using the one hand scoop technique. I'm going to do that. I'm going to do that. And then put the syringe down. If we do prepare this medication not at bedside with the patient, away from the patient, we would label the syringe with the patient's name and the 2 insulins on, and then put it aside. Once we're going to clean up our area, and then we're also going to administer, we're going to go back to the patient, administer the insulin, check on the patient to make sure there's no adverse side effects happening, how the patient is doing. We're also going to document what was done to the patient, what insulin, what time, what route, the 6 rights of administration we would document. We would place the call out within the patient's reach. If the patient doesn't have any questions, then we can go ahead and remove our gloves, and then check on the patient in a little bit, see if they're still doing okay, and then let them know that they could have their breakfast within the next 15 to 30 minutes.